If you've had a parent or sibling have a heart attack before the age of 60, there's one blood test I really want you to have, and the NHS doesn't routinely do it. It's what explains why heart attacks run in families, and even as an NHS GP, I can't routinely offer it on the NHS. It's called LP little a. It's not on the standard NHS panel. UK guidelines don't recommend it for general screening, however, multiple other countries do. In fact, in March of this year, American Cardiology Association have made it a Class 1 recommendation to test LP little a. So Class 1 recommendations are the strongest level of evidence that exists in clinical medicine. And they suggest that every adult should have this test at least once in their life. So here's what it is. You've probably heard of LDL, the so-called bad cholesterol. So now picture an LDL particle as a small delivery vehicle moving through your bloodstream. LPA is the same vehicle, but with an extra protein attached to the outside. That one structural difference changes everything about how it behaves. First, it can help build inflamed cholesterol plaque inside the artery wall, which is why high LP little a is linked with premature heart disease. Second, it may interfere with the body's ability to break down clots, and that matters because a heart attack usually starts when a plaque cracks and a clot suddenly blocks the artery. So LP little a can be thought of as a double threat, both plaque risk plus clot risk. LP little a is not like normal cholesterol. Is mostly inherited. Around 70 to 90% of your level is genetic, so for most people, it's effectively fixed for life. You can be a marathon runner and have a dangerously high LP little a. You can eat badly and have a low one. Lifestyle does not meaningfully lower the LP little a number, and statins do not lower it either. That means you could have had a normal cholesterol test and still have a major inherited risk that nobody's measured. But knowing your LP little a changes the plan. It means that you treat everything else harder. You treat the LDL, the ApoB, the blood pressure, the insulin resistance, the smoking, the weight and inflammation. You treat all of those things harder. You bring the targets down for those things. So PCSK9 inhibitors may lower LP little a modestly, and new targeted LP little a drugs are coming, but most people are still walking around without even knowing their number. Roughly 1 in 5 adults has high LP little a. You only actually need to test it once. If you comment panel, I'll send you the list of tests we run at Bespoke Health Clinic and why they're important.